Hi, and welcome to today's Cancer Biomedicine BSc and MSci taster session, and thank you very much for joining us today. My name is Juhi, and I'm a current Cancer Biomedicine student here at UCL and your chair this afternoon. We are hoping this taster session will address those course-specific questions you may have, and we will help you to gain an insight into what it's really like to study on a Cancer Biomedicine undergraduate program. So this afternoon, I will speak to Dr. Thiru Surentheran and Dr. Alwyn who will introduce you to some of the great science and medicine that you would learn as a student of the Cancer Biomedicine, BSc or MSci. Our speakers will also provide a summary of the Cancer Biomedicine program, and there will be a Q&A session for the second part of the event. This session is being recorded and it will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout the Q&A using the function on Zoom. And now to introduce our speaker to you, we have Dr. Thiru Surentheran, and Dr. Thiru is the Associate Professor and the Program Director at the UCL Cancer Institute. He is an experienced academic in biomedical science, teaching across undergraduate and postgraduate levels. His research focuses on host pathogen interactions, viral carcinogenesis, and novel anti-cancer and antimicrobial agents. Since September 2024, he has also served as Student Success Lead. And we have Dr. Alwyn with us as well. Dr. Alwyn is a lecturer and a research scientist with over 20 years of experience in cancer research, specializing in prostate cancer. His work focuses on understanding disease progression and treatment resistance, with the aim of developing new therapies and enhancing the effectiveness of those existing ones. Dr. Dutt also investigates the role of androgen receptor in normal physiological systems, contributing to the broader insights into cancer biology and therapeutic innovation. Over to you both. Thank you.
Thank you for the nice introduction. This part of the taster session, we would like to introduce you into why we need to learn cancer, and then a flavor of what the course entails, and then we'll give you a course overview as well, program structure, and then we'll address any questions that you have at the end of the taster sessions. So it's important to study cancer, why cancer is relevant to us. You know that cancer is common and can affect all of us, and it's also relevant to anyone working in biomedical sciences or medicine or any other affiliated careers. And you can see, based on the Cancer Research UK statistics, that we can see that the new cases of cancer, the death, and then survival, and you can see that cancer is classified as preventable cases as well, in terms of around 38%. So we could see that looking into strategies that we could whether treat cancer or whether we can find avenues where we can invent strategies to think about preventing cancer that could bring the cancer mortality significantly. So in terms of cancer risk and survival, we can see that due to the aging population, there's a increased risk of for people to develop cancer. So what we could say that most people are getting cancer. The good news, what you can see over the last few decades, the survival rate, cancer survival rate has doubled as well since the 1970s. So it's the treatment, due to treatment care, improvement in improvement of variety of treatment options, and so we can say that more people are surviving cancer. So we'll be looking at the risk of cancer. Again, in our lives, half of us will hear the words, you have cancer at some point in our lives. So the ambition for us as cancer researchers to ensure that 3 in 4 people will survive cancer within the next 20 years. How we can do this is looking at different treatment options for cancer. So when we look at treatments for cancer, there are 3 main options for cancer treatment, which are surgery, chemotherapy, and radiotherapy. And most patients often have a combination of these. And also what is in the pipeline, there are new treatments, they are becoming more advanced and becoming more personalized, and we can target particular molecular and genetic features of a tumor. So it's become more patient-specific treatment approach to tackle with this high incidence of cancer and the risk of cancer. So what is happening over the past 12 months here? We can see that most of you probably know that around 1/5 of the world cancer incidence is due to pathogens, particularly viruses, tumor viruses causing cancer. So again, this is important about thinking about cancer caused by a virus, and we can start thinking about preventing cancer as well through vaccination programs. Again, a very good example of that is having a vaccination program against one of the viruses causing cancer, which is human papillomavirus. And again, you can see that new trials are beginning to happen, and novel, all these, and then vaccine trials, again, cancer vaccine trials. So again, we can see that sort of a lot of innovation in the field, and it's a very dynamic field where we can find patient care is improved on a frequent basis. So when we're looking at innovations in cancer care, we've got to think about how cancer researchers can contribute into that to establish new therapies. So important aspect of this part of that, to understand how and why cancer develops, and then thinking for how we can screen for cancer, so we can early diagnosis would be beneficial for these people. So that's very, very important aspect of our strategies to tackle with cancer, and then demonstrating how novel treatments may work. And the most important aspect of that would be to think about avoiding resistance to current treatments as well, testing new drugs. So translating bench work to bedside treatment for patients with cancer is one of our ultimate goals as cancer researchers. So the Cancer Biomedicine BSc, or the Integrated Master's Program at UCL, we were looking into explore the improvement in treatments and patient outcomes, and that's really important in driving this forward and saving many lives. So we can see cancer research is pivotal in understanding why cancer develops, thinking about diagnosis and developing screening, discovering new drugs, and combining those sort of treatment options to combat cancer treatment resistance as well. So it is a relevant and stimulating degree that would equip the graduates with the skills to drive innovation across biomedical sciences in the future. So this, again, as we mentioned earlier on, from bench to bedside, and when we consider the program at UCL Cancer Institute, UCL itself is a major national and international hub for cancer research, and the Cancer Institute is a world leader in the cancer research over many years. So what is the advantage of studying cancer biomedicine at UCL? It's because we collaborate with different organizations, including the NHS, UCLH, Great Ormond Street, National and Royal Free Hospital. So we work with clinician scientists who will see firsthand and how laboratory work eventually translates into improving patient care. So what will I learn in the course? And you can see that initially we're looking what goes wrong in cancer, why do cancer cells survive? So we understand the basic biology behind cancer cell survival. And then when we're looking at how do we study cells in the lab. So we do have practical sessions where we would explore the behavior of cancer cells in the laboratory. And as I mentioned earlier on about infections and cancer and all the mechanisms behind that. And then we look at the role of the immune system in cancer. It's a very important aspect of dealing with cancer and cancer therapy. And we also look at the different modalities of and how do they work, such as chemotherapy, radiotherapy, and then we also look at that personalized medicine, personalized medicine, and we look at more into that precision cancer care. And we also think about how cancer trials are conducted and how they can improve patients' outcome. So it's most important to think as well, the cost of cancer as well, and how expensive cancer care. I'm going to pass it on to my colleague, Dr. Dart, to give you a flavour of what the course entails.
Okay, thank you very much, Thiru. Welcome, everyone. I'm going to give you a short taster into the kind of topics we cover on the course. And if you start off with this question, when you think about cancer and the disease of cancer, what are the main characteristics that you associate with cancer or cancer cells? So I'll just give you a couple of seconds to have a think. And then I think the majority of us would say that cancer is a disease involving rapidly dividing cells. The cells are dividing out of control, and then they'll also develop the capacity to spread and become motile and metastasize around the body. So if we were to look at tissues, cells down the microscope, we can see that all the organs in our body are very, if you look at the cells within the organs, the cells are distributed and arranged in a highly specific manner. You can see in these diagrams on the screen that there are layers of cells growing in a very structured and orderly manner. And we can see that every tissue in our body is made up of these cells that know exactly where they should be within those tissues. There's a very tightly regulated mechanisms behind this, or we'd lose our tissue morphology. So I want you to take a moment then and imagine yourself as being a cell within one of these tissues in the body. Now, within the tissues in the body, the cells are generally kept in a very orderly state. If there's a need for more cells or more, cell division, then that tissue will undergo cell division. However, if you can imagine yourself as being one of these cells within the tissue, what questions would you want to ask yourself before you were going to decide to divide within that tissue? So I'll give you just a couple of seconds to have a think about that question. What would you need to ask yourself before you decide to divide? So in the process of moving on, I will just come up with a few suggestions. That one of the main questions the cell needs to ask itself really is, should I divide? And in this context, the cell needs to know whether it's appropriate for that cell to divide within the tissue. Is it actually required? Is there an overall need for more cells within the tissue? And also, very importantly, the cell needs to ask itself, is there any damage to be repaired before I start the process of cell division? And also some other important questions that need to be asked are, can I divide? So do I have enough energy to divide? So all the processes within cell division are highly energy requiring. And do I have the nutrients? Do I have the actual raw materials to produce a whole other cell? So if the answers to all of these questions are yes, then the cell will divide. So if we imagine a cell, for example, here, cells are in constant communication with their surroundings. So again, I'll ask you, what kind of communication systems do cells use? Excuse me 1 second. You're just having some microphone issues. There we go. Okay. So what kind of communication systems do cells normally use? So have just a few seconds to think before we move on. So cells tend to use things like hormones and chemicals, protein hormones, growth factors, cytokines, steroids, and in some very rare instances, gases as well. So these are all the kind of ways that cells communicate with each other across distances within the body. If we were to zoom in on the cell, we would realize that the surface of the cell is covered in receptors for all these communication molecules. So if you were to zoom in again on the actual plasma membrane of the cell, you would see it's covered with growth receptors like this that actually sense the cell's environment. They sense whether there's a growth hormone or steroid present. So the cells are in constant communication with their environment. And in this animated slide, we can show you that when a growth factor or a growth hormone binds to one of these receptors on the cell surface, it triggers a whole plethora of cellular communication mechanisms that happen within the cytoplasm of the cell, leading to some kind of genetic response from the cell, or perhaps a growth response from the cell. And this is how cells generally, in a very simplistic manner, how they sense their environment and respond accordingly. So as I mentioned, the cells will be in constant communication with their environment. So they'll monitor growth stimulatory signals, inhibitory signals, nutrient levels, and they'll also monitor whether there's any damage, like in the DNA, for example. So I'm going to talk very, very quickly about the genes that actually govern some of these processes. So if you've ever heard of the word oncogene, these are normally genes that have a growth stimulatory function within the cell. They tend to act as accelerators. And if they were to acquire mutations within them, they can become much, much more active. Or perhaps their genes can be duplicated as well. They can make, there's more genes present in the cell. So in this kind of scenario where we might have an oncogene expressing, we might get a stimulation, for example, by an outside source for a growth hormone that could lead to this cascade of signaling within the cell. But for example, if we had an overexpression of this receptor on the cell surface like this, then we'd have an amplification of that growth stimulatory signal, and then we would have an over response or an increased response to a growth hormone. So you can see very suddenly now that a change in just one of these receptors can make the cells grow above and beyond their normal capacity. Also, we can have mutations in these genes, in these receptor genes. And here in this slide, you can see that this receptor has become active already without any stimulus from the outside. So something's happened to this receptor that's made it become active, and now it'll signal into the cell to stimulate the cell to grow in the actual absence of an external stimulus. So these cells are now growing in an uncontrolled manner without any stimulus from the outside. So these cells and their growth patterns are stuck in the on position. So if I was to use a very old-fashioned analogy now of a car or car engine, if you're traveling along in your car, you have two ways to control the velocity of that car. You can accelerate that car, or you can press the brake pedal to slow that car down. In our oncogene analogy here, if you have a mutation in one of these oncogenes that makes the cells more active, then this is similar to actually pressing down the accelerator pedal in the car. But as we know, in the car, we have another mechanism of control. We can use the brakes. So cells, actually within them, have genes that function as brakes on the cell cycle and the cell division mechanisms. They also help to carry out repairs. So normally, in cells, if there's any damage to the DNA, these cells can stop their growth, and this gives them time to repair their DNA. These stop signals can often fail if the proteins involved are mutated. So this is where a story comes in for using the vaccination against various virally induced cancers. Some viruses in our environment actually have proteins within them that destroy our repair or breaks in the cell cycle. So these cells can then no longer stop to repair their damage. So whereas in a normal cell, if our DNA became under attack from our environment, for example, from radiation, then the cell would have time to repair this damage, and then following this, it would grow and continue to stay healthy and grow normally. However, in cells with defective repair genes or these defective breaks in their cell cycle, this DNA damage may persist, and it may persist to the next generation of a daughter cell. And then this gives us a scenario where we have DNA damage and further mutation, and this then sets these cells on the road to cancer. So the tumor suppressor genes are involved in stopping the cell cycle. These are our brake pedals in our car analogy. And these are involved in stopping the cells from growing and dividing and allowing the cells to have time to repair their DNA. And the viruses, for example, like HPV, actually inject our cells with proteins that actually stop the cells being able to stop their cell cycle, and in some instances can actually stop the cells from having time to repair their DNA. So this is one reason why the HPV vaccination has been rolled out, because if we can block the HPV infection cycle, we can stop the HPV from affecting the cells in the body, and then the cells can grow normally. So this is one way to eradicate certain types of cancer from the human population. So if we go back to my car analogy again, normally the car would be traveling across along the road, but if we have a brake that's not working, one of these tumor suppressor genes that isn't working, then that car is going to start to go out of control quite rapidly. And if we lose all the brakes and we have one of those oncogenes that have also been mutated, then we have the worst case scenario where this car is going to travel out of control. So in our cell cycle analogy here, if we have an oncogene that's have been mutated and is giving a permanent acceleration signal, and we have a tumor suppressor gene who might be lost, so we have no brakes. So you can see that in this model, the cell is going to start to divide and grow out of control. So I'm going to finish off with just a couple of examples very briefly in what I mean. But here we have a cross-section of a very simplified prostate gland. And you can see within the prostate gland, there's a large empty space in the center, and this is surrounded by a single cell layer of epithelial cells. Now, if one of these epithelial cells starts to lose control over its cell cycle, it either has one of these accelerator genes or a tumor suppressor gene that's been lost, so it can't stop its cell cycle. These cells will begin to grow like this and begin the process, what we call carcinogenesis. So they'll start to lose control over their cell cycle, start to grow out of control, and start to acquire more and more mutations as they go, leading to a more aggressive cancer phenotype. So if we can look at some pathology specimens of, for example, in this specimen, we have the real picture now of what a normal prostate gland should look like. And if I can draw your attention to the darkened cell layer in dark purple on this slide, you can see that these epithelial cells that line the gland are only one cell thick. Whereas if we start to lose control over the cell cycle, we start to, one of those tumor suppressor genes becomes inactivated or lost. This is the initial effect on that prostate gland tissue. Now you can see that the epithelial cells lining the gland have become thickened. Those cells are proliferating out of control. And we can see that there's many, many more cells in this piece of tissue now. And I can just zoom in more closely on some of these sections. So you can see on the left-hand side, in a normal tissue, we'd only have a cell layer that's only one cell thick. And now, by losing one of those brake pedals on the cell cycle, those cells have begun to grow out of control. And now we have a cell layer here that's about 10 to 20 cells thick. So things are beginning to grow a little bit out of control. So just to summarize and finish off this section, you can see that in the image on the right-hand side, we can see how these proliferating cells, which have now lost control over their cell cycle, will start to grow out of control. So again, I'm going to finish off with this tissue specimen. This is an entire human prostate section. And in the dark blue bottom corner of this specimen, that's where the cancer or the suspiciously proliferating cells are within this tissue. And in the top part of this tissue is relatively normal. So you can see that within the tissue, which is quite small, there's one area of the tissue that is growing out of control. If we zoom in on these two areas, you can see that in this dark blue area in the bottom picture, those cells are now rapidly growing out of control. And you can also see, hopefully you can see how difficult it would be for a clinician to, if you were taking a sample from this tissue, just how close the normal tissue is from the cancerous tissue, how difficult that makes biopsy specimens and prognosis for disease. So I'm going to finish there and just allow you to kind of imagine that's the kind of general topics that we cover on some aspects of the course, where we investigate the cell cycle machinery and the aspects of cell growth in much, much more detail. So I'm going to finish off there and just to summarize that cancer is this multi-step genetic disease. We need an oncogene and a tumor suppressors to become mutated for cancer to develop as a disease. So now I'm going to hand you back over to my colleague Thiru, who will carry on with the course structure for you.
So we're just going to give you an overview of the course structure of the BSc program, and then we talk about the integrated master's program in cancer biomedicine as well. So in terms of year one, the course is structured around to give you fundamental physiology, general biomedical science knowledge for you in your year one, which it covers the foundation in biology, anatomy, biochemistry, and most of the physiology aspect of different organ systems. And then when we have a specific module in cancer, cancer, which is cancer medicine in society. The first year is shared with other programs as integrated medical sciences in the Faculty of Medical Sciences. And then the most important things here for the first year is to understand the physiological condition of healthy individuals, and then think how we can look at what happens over in the pathological conditions, disease processes. So when we look at years 2 and 3, then it's more focused on cancer-specific content. Still, we provide optional modules to look into other areas in biomedical science. If we look into cancer in more specific detail in years 2 and 3, we think about the biology behind cancer, how cancer develops, and what kind of treatment options. We also look at clinical perspective of those cancer, including treatments, and then also we look at trials, clinical trials, and then how personalized medicine is developed. We also look into how radiation cancer biology, how radiation can be used to treat cancer. And also we look at things like pathogens in cancer, particularly viruses, you heard from my colleague about, and how we can target and find new therapies against these viruses causing cancer. We also have modules covering the nutritional aspect of what's the impact of cancer and the cancer treatment on a patient's nutritional status. And we also look into pediatric and young adult cancers as well. And then as part of the program, you do have a research project where you'll explore some aspects of that research in cancer. If you chose to do the MSci Integrated Master's Program in Cancer Biomedicine, and then we'll have a 4th year to look at more specific advanced knowledge at master's level to study cancer and cancer research. So the MSci program allows you to, to expand your knowledge at that sort of master's level. Is an additional 120 credits in your 4th year. And you do have a structured project in year 3. And then you do an extended project in year 4. It is a unique program in the UK, and we can say that is the only MSci program in cancer offered in London. And it's focused on mainly on theoretical knowledge and looking at advanced and novel therapies in cancer care. Also, those translational skills are important for conducting research. In terms of progressing from your BSc year 3 into MSci program, you do need to think about that the performance is based on the performance of years 1, 2, and 3. There's an opportunity that students can change between BSc and MSci programs during the process of your time at UCL. So as we said that in year 1, we just start together, one starting point and range of possibilities, and then you focus on your specific program in years 2 and 3. And these are some quotes from our students previously, the experience from the program. And what we think about in terms of career destinations, a program itself could give opportunities for any graduates to think about further studies at the master's level, or if you're doing an MSci integrated master's degree here with us, and then that actually gives you that experience, or potentially a master's by research, or going further into doctoral studies. And also, another area of interest is that a lot of our graduates chosen pathway to go into graduate medicine and other affiliated careers. Or the course, it also entails broader biomedical science knowledge, so you can still apply that knowledge into wider areas of biomedical science, and also other areas such as pharmaceutical industries or clinical trial practitioners. So again, it's very, very important to see that it gives a broader opportunities for anyone doing the course to think about future careers. So we'll pass on to the chair to address the questions.
Thank you so much, guys. Please do share your questions using the Q&A function. If you just give me a second, we can all answer a few questions for you. 1 second. And as you can see, we've got our 2 doctors right next to me, and we'll be answering your questions, so please do share them. And
Okay, it's okay. If there's any question. Don't worry, don't worry.
guys.
All right.
Okay. So our first question we have, how do researchers deal with cancer cells that don't respond to treatment within the same tumor? One of our doctors would like to answer the question.
Is it written down? Sorry.
So how do researchers deal with cancer cells that don't respond to treatment within the same tumor?
I can probably try and break that question down into 2 parts. So basically, it's very often that we find cancer cells that don't respond to treatment, because this is essentially the main question that we are trying to address as cancer researchers. If we had a drug that worked perfectly for cancer patients, obviously there wouldn't be a disease issue. So our main research avenue is to try and find out how cells become resistant to various therapies. So we have several projects working together with our 3rd and 4th year students at the moment. We're trying to investigate how prostate cancer cells can become resistant to various forms of therapy. And essentially that is the crux of our research question. That's exactly what we want to find out. That is our goal overall. So I don't have any immediate answers for you, because that is the ongoing research that we are currently doing. I don't know whether that answers the question, but I guess we don't have a definitive question. That's just our raison d'etre really is to find the answers to these questions.
Thank you so much. So we have another question. Could you choose the MSci without studying the bachelor's degree first?
You could start with an MSci outright. You can enroll onto an MSci program, which is a 4-year program. It's an integrated program. So you could do that. But I have to reiterate that there's a requirement for you to go into the 4th year by the end of 3 years. So everyone is expected to achieve that requirement as academic requirement by the end of year 3. If you meet that requirement, you will progress into your 4th year. So you can enroll outright on the MSci program.
Thank you so much. So we have another great question here. So what is the ratio of theory to practical elements in the course?
It's a difficult question to answer. I think when we look at years 1 and 2, we do have practical elements, but we do develop a lot of ideas about fundamental. As I said, that year 1, we do how a healthy physiological condition may look like, before we move into look at specific disease and think what changes are happening in that condition to leading into a disease like cancer. So cancer, that is more than 200 different types of cancer. We could treat those individual cancer types as separate diseases in order to tackle. So it's a lot of knowledge to learn. what we could see, first years and second year, we do have core practicals, not necessarily everything on cancer, but just learning the key techniques. But when you come to year 3, whether you're an MSci or a BSc student, you'll be doing a research project, and you'll be, again, learning very cancer-specific aspect of practical elements of that as well. But if you're continuing with an MSci program, it will provide an extended project where you do about 3 months of research work full-time in the lab. That actually gives you a lot of research experience if you want to stay in the career and think about doing a doctoral studies in the future to have a PhD and then move on with a research career as a focused career.
So we have another question here. What kind of work experience would be helpful? And I assume this is regarding with applications and personal statement.
I think it's in this program, it's kind of having a knowledge, basic knowledge before you're coming into the program. And I think, so we're not asking for any specific work experience, but it's building that fundamental knowledge and everything would be good. There are good books to read as well, before you come, you think about cancer as a carrier, thinking about that. So I would suggest one book is a not really nice overview, holistic view of cancer. It's called The Emperor of All Maladies. There's another one based on the sort of cell lines, where we talk about cell lines and the first cell lines generated on from a cancer patient, which is vital. We can see now that that's driven all this research to this far in advanced cancer research, which is called The Immortal Life of Henrietta Lacks. So again, so those kind of 2 books are quite useful to think of reading to get broader knowledge. But when you come onto the program, then we will try, as we said before, we will try and build that knowledge from your first year, general physiology aspects, and then introducing to cancer medicine and society will again look at a holistic view of cancer, history of cancer, the impact of cancer into society, the cost of cancer. Cancer treatments can be very expensive, so we again teach you. And then going into second and third year, we do have more of that detail. So we're not specifically looking any specific work experience, but having a general knowledge and interest on cancer will be vital for you to follow this program.
Perfect. And as a student, when I was applying and did my personal statement, of course, it's very hard to get hands-on experience in a cancer industry. So what I did was I watched a few podcasts, TED Talks are very amazing, and of course, looking at the latest advancements in cancer industry. And I think those are very good to show that you have the initiative to do further research in cancer, as everyone does study about it in A-levels. And you do want to have that extra edge and have that extra understanding of cancer. And you could, of course, include that in your personal statement. And you could also talk about family members, for example, and how that might have influenced you and persuaded you to study this at an undergraduate level, despite doing it at master's level, which many biomedical students do choose to do. So that was a great question. Thank you so much for asking. Another question I have here is, if I'm applying to cancer biomedicine as my 5th choice, other for being medicine, could I submit a separate personal statement more specific to why I want to study cancer biomedicine?
Again, it's kind of a question to the admissions, but what we could see is a broader, I think at one personal statement with that sort of impact on interest with cancer, because in medicine it covers, oncology is one of the biggest fields, you can see that. So if you think about adding that information, that covers the cancer biomedicine, and that would justify why you want to do this course, if you want to follow cancer biomedicine. So I cannot see anything very specific that we're expecting as a separate personal statement in that situation.
Of course, as long as you show your interest in cancer in one of the paragraphs, that should be more than enough. Thank you so much. So a question I have here is, if I repeated year 12 for personal reasons, not part of extenuating circumstances, would I automatically be rejected from the application process?
Yeah, there's no clear answer to this on that, but we cannot see that as a issues.
Thank you so much. So I love this question. So someone has asked, what new cancer research therapies are you looking at? I've heard about checkpoints on T cells and monoclonal antibodies. Could you please elaborate?
Question? Okay.
new research therapies?
It's a very broad question. I mean, if we're talking about the general cancer research field as a whole, or us as individuals, I think I'd rather answer it as the whole generalized answer for every kind of cancer type. As Thiru mentioned, cancer is a disease of at least 200 different cancer types. Within those cancer types, each individual patient will have their own cohort of mutations in those oncogenes and tumor suppressors, and then possibly hundreds of other genes. So the statement is really that every single patient, their cancer is unique to them, and it'll change over time within that patient. So the kind of general consensus is to shift cancer therapies to more personalized therapies. This may involve immunological therapies, where you might have T cells, for example, raised against a specific mutation found in that one patient, or therapies like drug therapies that are targeted specifically for the mutations in that person's own cancer, their unique cancer profile. So the whole cancer field is shifting towards personalized and targeted therapies, and I think that would cover everything. Okay.
Another very theory-based question we have here. What makes mutations in oncogenes more dangerous than those in tumor suppressor genes?
A very quick answer to that is that for tumor suppressor genes, because it's a loss of function, and we have 2 copies of everything in our genome, then you'd have to have 2 copies lost for a tumor suppressor to be gone from the cell. Whereas the oncogenes are activated by mutations, so only 1 copy is needed for that cancer-causing activity to occur. So that's why oncogenes are more dangerous, because 1 mutation is sufficient for that process, whereas tumor suppressors, you need 2. Okay?
Okay, so we have a question here. Are there any subject requirements to study this course, and what are the grades requirements?
So the requirement, a standard requirement for the program, 3 A's, 3 subjects, 3 A's, but we were expecting within those 3 subjects, biology and chemistry as part of the 2 subjects. So the 3rd subject could be another subject. So the requirement is A in chemistry, A in biology, and A in another subject.
Another amazing question we have here. Can we really create a universal cancer cure, or is personalization the only step forward?
I'm not sure if there is an answer to that question. I think it's such a broad and broad and very different disease from person to person. Even in the same person, it can change from month to month, and new mutations can arise. So I think it would be incredibly difficult to make one overall therapy. I'm not saying it's impossible, but it would be very difficult. So I think at the moment, targeted therapy is probably the better option. But you never know what's over the horizon.
I will add to that to see that I think that's what I mentioned about the book itself, to read, and it started off with about magic bullet, but I think one treatment is not possible, as we said, more than 200 times, and within patients, they're going to have variations in there, and it's difficult to treat every tumor cell, and this is where the cancer relapse and new therapies are needed. I call my colleague on that sort of personalized treatment, and that's why, again, it's an interesting field, and it requires, cost of cancer is very high as well. So there's a need immediately for us to act on to develop. So we've got to look at multiple angles to tackle with this disease.
So how many students are there in each year, and do you interview as part of the application process?
To answer the first part of the questions, a small cohort of students, not large numbers. So usually around 40 students in cohorts, up to 40 students in cohorts. And we don't do interviews for the program.
Oh, I like this question. What are some of the struggles researchers encounter, whether that is sharing their research or things like funding?
I would probably think most researchers would agree that funding is one of the biggest hurdles, especially recently with the kind of cost of living crisis and everything happening in the country. There's less money generally around for research, for charity research or for research funding from councils. So I think funding is probably the biggest obstacle, and things are obviously getting more expensive in the in the terms of biology and equipment as well. So funding is probably the top one, I would say. Yeah.
So what sort of careers does this course open up?
As we said, that the course is serving as a biomedical science degree, a typical biomedical science degree with a cancer focus aspect. So what we need to think about here is we're looking at a course where it can provide broader biomedical knowledge, but if you're interested in cancer, then we delve in a bit more detail into that. So you can develop that advanced knowledge at an undergraduate level. Normally cancer is taught significantly in a postgraduate level. So I think the important aspect of the course ties in with your interest as well. If you're thinking about going into research in cancer, and I think this course will the basics of that, and then you have an advantage of that. You know, when you start research, you have a lot of knowledge on a variety of different cancer and cancer mechanisms and therapies and so on. So a degree that would help you to progress, particularly with the MSci degree, we do incorporate a lot of research skills as well. So again, that's making kind of a transition for you to kind of undergraduate level into doctoral studies level, so it makes the transition quite good. But if you don't want to stay in cancer, again, still the skills we develop on the program will open up any other. You can use those skills we learn on the program to apply to other diseases as well. These techniques in molecular medicine are widely used across different diseases. And as we said as well, and we have had a lot of success in students thinking about becoming clinicians after the degree, so they can embark on a graduate medicine. And because the way we deliberate interaction with a lot of clinicians, you develop a lot of knowledge about how clinical practice, and particularly in cancer field.
Would this course focus more on the research of cancer or treating it in patients? And where would you work, e.g. lab or a hospital?
So we both kind of work in the research side of the cancer treatment approach, but the course has equal element of looking at. So we need to understand the fundamental science behind cancer development, and as we heard about the variations and the limitations. So and then but then how you conduct trials and have the treatment. So I would say the course has both elements equally embedded in the program.
Thank you so much. So are GCSEs taken into account when applying for the course? And if so, do they outweigh personal statements and work experience?
Not particularly, but I think the UCL standard requirement for GCSE will be taken into account.
So do you think it's better to do the BSc Biomedical Science first and then do an MSc in cancer? Or is it better to do MSci in cancer straight away?
We do have MSc in cancer, but because we run BSc in cancer as well, we've built a lot of knowledge on the cancer biomedicine program. So MSci is the most suitable way. We tailored the program based on what we teach on first 3 years of the undergraduate program. So it's again, we're looking at an MSci is an option if you're really thinking about a cancer research in the future, because we integrated that structure within the 4-year program. But if you are unsure, you can still join the BSc program. There will be an opportunity for you to switch to the MSci program, subject to meeting requirements. And so again, there's a possibility that you could still switch after following your BSc for 3 years, and you can still consider doing the integrated master's. So, but we cannot see any difference between if you have an opportunity. The MSci is, as we said, that it's one of the rarest MScis in cancer. So we don't have many around to offer that. So I think that's what I could say, that it's a great opportunity to have an integrated master's if you have the opportunity to do it.
And someone has asked, what are your thoughts on the course as a student as well as studying at UCL? So I'm, of course, in my 3rd year. I have had a very long time here, and it has been great so far. And again, to address some of the concerns previous students have had, is it only on cancer? So as discussed, we do a lot of broader modules as well, which does give me an understanding on molecular basis, on foundations in physiology. So I would say this is still an amazing course to do. And again, it has a lot of transferable skills within different sectors and different careers. And regarding UCL, of course, it's a top 10 university. And that alone is amazing to consider. But on top of that, the societies and the clubs, everything's amazing here. There's a lot of student support available. UCL careers, I was an ambassador last year, and I've seen how important and accessible it is for many students here. It's helped not only undergraduate students, but also postgrad students. And even after you leave the institute, they do still offer support for 5 years. So I think that's great. A lot of internships are available here, and that is one of the main reasons people do come here. Internships, whether that's research internships or in a pharmaceutical biotech sector, there's a lot of possibilities. And again, there's a lot of job opportunities within UCL, whether you want to run as a student ambassador, whether you want to work in the student union, or just giving feedback in general. There's many job opportunities here. And again, as you can tell, cancer biomedicine, I think we have said it's a small cohort, but I think that's what makes it very amazing. Everyone knows each other, we all name bases, everyone's very friendly, and I think we have a really strong community in general, unlike some of the courses that are 300 students plus. So I think it's amazing that cancer biomedicine is small in general. And again, not only do we do the theory and the research side, we do have a lot of lecturers coming in and also professionals outside of the university in general. So we do have guest lecturers, and they give us the latest advancements, and they talk about their own life basically, and they tell us how they got to the stage they are. So I think that also helps in a career setting as well, and you kind of understand where everything comes in. Everyone's doing different stuff, but it all joins together, cancer in general, and everyone's doing their part to enhance. So I think overall it's been amazing, of course. So what other questions do we have? Do many students use this course as a pathway into medicine degree?
We could say that recently we have a lot of increase in that, and they were successful as well.
And we have a question here. What part of your work do most people misunderstand or underestimate?
Not sure. I think we have to juggle quite a few different things. So it's not just teaching, it's not just research, it's a lot of admin, a lot of running around. I think people don't know what's happening in the background always, and we're always kept on our feet and we're through.
Yeah, I agree with that. Yeah.
And we have time for one last question. Let's see. How do researchers collaborate with clinicians and doctors?
In an institute such as UCL, I think that's quite an easy question to answer, because literally we have the labs, as you saw in the picture from Thiru, we have the labs on one side of the street physically, and then directly opposite we have UCLH Hospital and the Macmillan Cancer Centre directly opposite the research labs. So there's a lot of interaction between the clinicians and the scientists. We also have some scientist clinicians working at the Cancer Institute. So I'd say there's a very big amount of dialogue that happens between the clinicians and the scientists in the UCL. And this is one of our strengths, I think, as an institute, that we're very physically close and also kind of intellectually close to the goings on within the clinic.
And thank you so much for all the questions. We'll leave it here now, we're out of time. And thank you so much, Dr. Thiru and Dr. Alwyn for your time here. If you could all please fill out the survey that will appear on your screen right after this session ends. Thank you again for all your questions and comments, and best of luck. Thank you.
Thank you.